Welcome everybody to the ASAP2 webinar on PEPFAR Human Resources for Health Reporting Requirements. We will start in just a few moments. If you could take the time to put your name and your organization and country in the chat, we'd love to know who is here with us. Welcome everybody to the ASAP2 webinar on PEPFAR Human Resources for Health Reporting Requirements. Risa Griffin from USAID will be presenting, and Kyle Borses will be answering questions or asking questions for her. Just a few words. Please use the chat for putting in your name and your organization and what country you're in, and please use the Q&A box for any questions that you would like to pose to the presenter. The presentation in today's webinar will be saved on our website. Just a quick word about ASAP2. We are in the last few months of the program, and we will be ending on October 31st, 2024. And we're very privileged to have had this experience. We have worked in 18 countries in Africa, and we supported 126 local organizations and 13 local governments. We have done over 111 webinars for over 22,000 people, and you can see all of them on our website. Here's a list of upcoming webinars. So we have today's webinar, then we're going to be doing the French webinar for business development. We have the English closeout webinar on the September 24th, so Legacy to Path to Prime and Road to Sustainability. At that webinar, we will be sharing all of our legacy tools and making them available to everybody. So the tool that we've compiled is a compendium of resources. It's a one-stop shop for local organizations to access all of USAID's rules and regulations, technical policies, links to training webinars, local partner meetings, tools, templates for each of the NUPIS domains, and technical areas to meet compliance standards. So the table of contents is on your left, and then what you'll find in each of those is online resources, which will be periodically updated with new policies. Everything has been translated into 7 languages: Amharic, Chichewa, French, Hausa, Portuguese, and Swahili. And each section includes policies, templates for organizational systems, capacity standards, training material, and online opportunities. This is just a snippet of a few pages that are included. So we have all of USAID's compliance standards translated again into those 7 languages. We have all of USAID's policies in one place, again translated. So come to the webinar on the 25th and you will be able to access this document. Thank you and enjoy the webinar. I'm now going to hand it over to Risa Griffin.
Great. Thank you, Catherine, and thank you, Jeff and Fikra, the whole ASAP team. So thank you all very much for joining us today at whatever time it is for you. Let's see. Let me get my slides going. There we go. So yeah, my name is Risa Griffin. I'm a data scientist in the Health Workforce Branch in OHA in Washington, D.C. And like Catherine mentioned, I'm also joined by my colleagues Kyle Borses and Geraldine Hoover. So Kyle and Geraldine will be monitoring the Q&A box while I'm speaking. I won't really be able to look at the Q&A box during the presentation, but they will be noting your questions, answering some of them, pulling them out. And we have several points during the presentation where we will pause and go through the questions that have already been asked and invite you to add more questions. I just really want to encourage you to, if you have a question, probably someone else has that question. So please do ask. And we will also be sending out later after this webinar, we'll be sending out a Q&A document that we'll be updating and adding your questions to. So it's actually really helpful for us to have those questions. Okay. So here's just a very rough agenda of what the next almost 2 hours will look like. We might stray from these times a little bit, but this is the idea of the topics we'll cover in the time that they'll take. Okay, so we're going to start with just a quick introduction to the Human Resources for Health Inventory. So these are numbers that I'm sure a lot of you are quite familiar with, but some of you may have not seen yet. So this is from last year's HRH inventory, so the FY23 numbers, and you can just see the huge impact that the PEPFAR support for staff makes across the many countries that PEPFAR works in. So more than 200,000 individuals are supported through PEPFAR's work. That's in FTE, almost 120,000. And in total, 51% of USAID's total expenditures are for under PEPFAR are for HRH. So it's quite a big chunk, and it's very important that we measure this and that we measure it accurately. And that's why we rely on all of you and appreciate so much you taking the time to come and learn about how to do this reporting process. So as we're thinking about optimizing our HRH and also thinking a lot about sustainability of the programming and of the response to HIV, this data has become more and more important and more looked at. We are constantly getting requests to look at things in the HRH inventory data. We're using this data for planning, for decision making, for program evaluation and planning. So it's very important. And I'm sure I'm preaching to the choir. I'm sure we all understand, because we're here, how important it is, but we really just want to emphasize that. We also align the HRH inventory to expenditure reporting. So there are quite a few fields that are mapped to the ER, to the expenditure reporting fields, and I will highlight those as we're going through the different columns or the different data points. And we've actually made a couple of changes this year to align even more with the ER category. So hopefully that will help and make reporting go a little bit more smoothly, and also on the other end make our analysis of the data a little bit clearer. And you can see there's going to be on a few slides a little box outlined in blue, like you see in this slide at the bottom left, which will just highlight that this is a field that's aligned to ER. So what are the tools that we're using for the HRH inventory reporting? So the template that the data is entered into by all of you, that's an Excel template. We will go through in quite a bit of detail what that template looks like. And then after the data has all been entered into the template, validated, checked for errors and outliers, then you will be uploading it and submitting it in Datum. And I'm sure many of you who've done this already are quite aware that Datum does have some checks that are performed that have to be passed before will be able to upload the data into Datum. We've added a couple of things that we're hoping will help ease a little bit of the stress of those checks that I'll get into later, but that's just important to note. So who needs to report to the HRH inventory? Almost everyone. So any mechanism that reports staffing expenditures to expenditure reporting should also report to HRH inventory. If you've done this before, you know that we will check. And if you've submitted a ER report that includes staffing expenditures, then we will check and say, oh, we don't see an HRH inventory report from this mechanism. What's going on there? And likely reach out. But it's better to get ahead of that and just make sure you're doing both of them. So what the process looks like is subrecipient partners should fill out the template for their own staff and then submit that template up to their prime partner. The prime partner will then consolidate all of the subrecipients so that we have one template per mechanism that will be then uploaded into Datum. And one thing I do want to note, and I will mention a few times, I think, is that while we do have a lot of alignment with ER, and we ask that if you are submitting an expenditure report with staffing data, that you also submit an HRH inventory template, we don't expect exact alignment between the staffing expenditures reported in the ER report and in the HRH inventory. We will check and make sure that they're not wildly different, but because of some differences in how the reports look at the expenditures, we wouldn't expect an exact dollar amount match. So just something to note, and we'll talk about that a little bit more later. Okay, so who should be included in the HRH inventory? Which individuals or which staff? So we have this very nice little flow chart to help you figure out if the staff that you're entering should be included. So any individual who's received any form of compensation from PEPFAR over the past fiscal year. So that would mean any type of health worker. So doctors, nurses, etc., as well as community health workers, ancillary health workers, anyone who's done program management, technical advising, and HQ staff who are charging directly to the IM. And what you will be entering, again, we'll go through these fields in more detail later, but you're going to be entering the full compensation that these staff have received. So that would include salaries, stipends, any non-monetary support, as well as fringe benefits. These reports need to be submitted by both prime and subrecipient IPs. Who's not entered would be any staff that are charged only to NICRA. They would not be included in the inventory, as well as US government staff would not be included. Okay, so let's look at the timeline. So the first step of the timeline, I'm sure many of you attended the GHSD kickoff webinar yesterday morning. If not, that recording and slides will be available, and we'll be covering a lot of the same information today. So then today is another big kickoff point with this training. Beginning hopefully as soon as this training ends today, or maybe you've already even done this, you will be making sure that your Datum accounts are up to date, that you are able to access Datum. And I will speak towards the end of the training about some changes this year that make us want to really encourage you to figure out Datum early. On October 1st, the data entry window will open in Datum. So you should be able to download the template even before that, but starting October 1st, the window opens. And then we have until November 15th for the first round of reporting. So please have that November 15th deadline in mind, but I really encourage you to submit earlier if possible, because if there are any issues with uploading a Datum, if you get caught by any of those quality checks, it's really helpful to have a little bit of extra buffer time there to make those corrections. We'll then have our cleaning window in early December. And then after the cleaning window, you will receive reports from us. Mostly Kyle and I will put together reports to flag any possible issues we might see, share them back out to our contacts in the mission. And then you will have until December 13th to clean up and resubmit your data for the final time. So that's what the window looks like this year. I think it's pretty similar to previous years, but we're happy to take any questions or anything. Okay, so what do you need in order to complete your HRH inventory template and submit it into Datum? So you will need a copy of your OU specific template. So you cannot, if you're in Cameroon, you cannot use a template for Zambia. They are specific to the operating unit where you're working. The drop-down options are targeted towards towards your OU. That's why it's really, really important to make sure that you have that Datum account. And every IP will need to have their own Datum account. So just note that, please. You will need the HRH inventory guidance materials. So those will be on Zendesk. There's a link here in the slides that you'll be able to access after this training. That will include some materials from Zendesk around setting up your Datum account, how to download the template, etc., as well as materials for the HRH inventory, such as the handbook, which will be very, very helpful. And I really encourage everyone to have that handbook bookmarked or downloaded to your desktop so you can use it as a resource while you're working on your report. On the other side, you will also need internal records like HR, payroll, and program records that capture where your staff work and the location of the work they're doing. And then, like we mentioned, you will need that Datum account. Very, very important. Okay, so let's do a quick little knowledge check. You can drop your answers into the chat. Which mechanisms need to complete and submit an HRH inventory Excel tool? I'll give everyone just a few seconds to drop those responses in. No one yet. No one feels brave, I think, to give a suggestion. Make a guess. Okay, here we go. All IMs charging PEPFAR, all mechanisms. Amazing. Yes. Great. So, oops, go back over here. There we go. All mechanisms that report in ER and have expenditures associated with COP approvals. So if you are a mechanism that doesn't have any staff at all, then yeah, you would not need to submit an HRH inventory. I think you probably wouldn't be on this call if you didn't support any staff, so that probably doesn't apply. But otherwise, if you receive PEPFAR funding, you report in ER and have expenditures associated with COP approvals, then you do need to submit an HRH inventory template. Okay. Right, one more knowledge check. You guys did so great on the last one. So what types of staff should be included? So only staff that are working through prime partners, only staff working through subrecipients, program management staff, clinical ancillary staff who deliver services, other staff that provide TA and support non-service delivery, or all of the above. We've got all. Yes, it looks like everyone is saying F, all of the above, and that is correct. Any staff that receives some form of support, and remember that does include non-monetary support, should be reported. So that includes everyone that we've listed there. And also important to note that this means prime and subrecipient staff. Remember that the subrecipients will complete the template, share it back to the prime who will compile to enter into Datum. Okay, sorry, I said one more, but we really had another knowledge check. So I promise we won't be quite as quiz heavy going forward. Should staff working for subrecipient partners be reported in the HRH inventory? This one's a little bit of a gimme because I just said it. So yes, the answer is all PEPFAR supported subrecipient staff working for mechanism should be reported. All right. And if there's any confusion around any piece of this, please remember to use the Q&A box and put your questions in. Okay, I clearly don't know how many knowledge checks I put in because we've got yet another one. When can partners begin to submit their completed FY24 HRH inventory templates into Datum? So this is a harder one. Who remembers the date from the timeline slide? Yes, October 1st. So November 15th, I saw someone dropped. That's when they are due. So that's the end date of when you can submit your templates, but you can start submitting them on October 1st. Great. All right. Awesome. Thank you so much for your attention and great participation in the quiz. Clearly, everyone's on top of it, so that's a great start. So now we're going to go through really the meat of this presentation, which is an overview of the template data elements. I will note at the start that there have been a few more changes this year than there have been last year. Nothing major, but a few additions and some refinement of some of the columns. We are hopeful that these will actually be really helpful to you all in putting together the template. They really came from conversations that we were able to have with our HRH colleagues in the missions, as well as with our implementing partner colleagues. We feel like these are responding to some of the big issues that were brought up. So hopefully you all will feel the same way and these will really be helpful to you. Okay, so the HRH inventory template that you will download from Datum specific to your own operating unit. We remember all of that. So it's going to be an Excel file and it will have 3 tabs. So first it will have a cover sheet. You can kind of see the cover sheet. I'll have the next slide where you see it more clearly, or a couple slides ahead. But this is where you just put in the high level information around operating unit, funding agency, et cetera. The next tab will be the staff list. So this is where you're actually entering each individual staff member, 1 row per staff member. And then the third tab is the FTE calculator. And so that's just a tool to help you accurately calculate what FTE should be entered for each staff member. Okay, so again, these are the 3 main sections. So we're going to spend most of our time talking about the staff list because that's really where the majority of your time will be going when completing the template, and the majority of our time goes when looking at the template. And it's also where any changes have been made. We haven't changed anything in the cover sheet or the FTE calculator. Okay, so just quickly, here's an overview of what the cover sheet looks like, what it includes. So you'll have the operating unit or country that you're based in or where your work is performed, the name of the prime partner. So even if you're a sub-recipient, it would still be the prime partner that you're working under. The name of the contact information for the prime partner. And then there is this unique identifier or UEI. This needs to, if you want to enter one of these, it should be 9 digits. An IP is not required to have one. So if you don't know what it is, you can just enter 9 ones or enter 9 nines if the IP doesn't have one at all. And then you will have a complete list of subs or sub IPs that were contracted out by the prime partner. So this tab will be completed by the prime when they're compiling all of the templates that come in from the subrecipients. They'll complete this tab. So there will just be one that is submitted up into Datum. If you're a subrecipient, you get the template, you're filling out the template. If you want to fill this out, you're absolutely welcome to, but it's kind of, if your prime partner asks you to, go ahead and do it. It's not really required on our end. Okay, so the staff list tab. This is a overview of all of the columns in the staff list tab. I'm sure that you see some of them might look a little bit different. There's only one new column, but the order has changed on a few. So first, just quick overview. Each line or each row will represent one staff member. So it doesn't matter if that person works full-time, it doesn't matter if that person works part-time, or even if that person maybe performs 2 roles. So maybe they spend 60% of their time providing technical advising or technical assistance, and then 40% of their time providing direct services. They would still be entered just in one line. And we'll talk about how you would handle that time split a little bit You do need to complete all of the fields. So if you leave anything blank that's not intended to be blank, then you're going to get an error when you try to upload into Datum. The exception to that is the blue columns, column Q through W with the geography hierarchy. We'll talk more later about when some of those may or may not be blank. But other than that, everything needs to have something entered into it in order for you to be able to upload the template. Almost all of these fields have drop downs, and this is why it's so important to download the correct template for your operating unit or your country that you work in. Those drop downs sometimes change based on the options available for your country. So for example, the PSNU and the community will change based on what country you're working in. But it's really important that you don't try to overwrite the drop downs to type in different answers. If you have different things that you think are important, that you think that need to be entered that aren't available in any of the column drop downs, please feel free to use the comments column. So that's the last column in the template. I think it's AI, it looks like. You can type whatever you'd like in that comments column. We do look at the comments. You'll see when we get to the employment title updates for this year that we really pulled heavily from the comments when we were talking about that. So we do look at them. I will ask, please do not put staff members or individuals' names in the comments. We've seen that sometimes, and that's really not ideal. We don't want this data to have any identifiable information. So don't put people's names, but please feel free if you want to put in a comment that gives something more specific about the work this person's doing or their job title that is not found in the list. That's fine. Please feel free to use the comments for that reason. But otherwise, no changes to the template. And also, I just want to note that it's always important, but even more important this year that you don't copy and paste from past year templates or from Excel sheets that are not the template. It will mess up the formatting. It will mess up the checks, the data checks. So you will not be able to upload into Datum if you do that. So quickly over to what might look a little bit different to you if you've done this before, if you did this last year. So the first thing is that the columns that are outlined in blue here, so that's direct service delivery, primary program area, and if the individual provides technical assistance, those have not really changed, maybe a little bit of refinement, but they have moved. So they've been reordered to come earlier in the template. The reason for this is because the Datum team has updated the drop-down options so that they're more dependent upon some of the earlier selections. And hopefully this will help simplify a little bit on the end of data entry so that you don't have to scroll through all of these employment titles that aren't relevant at all because you've already selected that this person doesn't provide direct services. You don't have to scroll through all the doctors and nurses, et cetera. So there's some dependency there now. So we've moved direct service delivery earlier in the template, and primary program area and provides technical assistance have also been moved a little bit earlier. The column that you see outlined in red, so that's column G, this is new. So this is a new column. We'll talk about it more later. We're very, very excited to have it. So it's asking if the staff member primarily supports Dreams programming. So just note those are the differences from last year. So again, this is just showing the order again with a little bit more detail in a list. And you can see from the legend over here, the color coding. So the green fields have just been reordered. So they've just been moved up a little bit earlier in the template. The blue, so number 7, like I just mentioned, is a new field that we have added this year. We've also expanded a couple of columns or a couple of fields, employment title, seconded to MOH, and what was formerly works primarily outside of the OU. Those have been expanded a little bit. I will discuss again later in more detail. We've also refined 2 fields. So that's around primary program area and primary beneficiary. We've refined those so that they align more closely with expenditure reporting. talk about later. Everything else is unchanged. So it's still the majority of the template has not changed. If you've done it previous years, then you will already be an expert. You'll already recognize almost all of the fields that you're entering. Okay, so the major top level changes that we have had for FY24. So under employment title, we have expanded the titles to add 3 new employment titles. So 3 new titles, they are all going to fall under other professional staff, not IP program management. So that's an important distinction. We've added the employment title Provincial District Coordinator, Program Manager Officer, Program Coordinator Assistant. So this, like I mentioned, we really looked through the comments that you all entered in your templates last year. We also had conversations with different mission POCs and also IPs. If any of you are joining from Zambia, I maybe came and spoke with you, and we really felt like these were the employment titles that came to the top as people saying, you know, we have people who are managing the technical side or the programmatic side of projects. They're not really IP program management staff, but there's not a good spot for them. We're hoping to get at that with these new employment titles, and we'll have the definitions a little bit later on. Like I mentioned, we added this new column for if a staff member primarily supports DREAMS programming. This means, those of you who reported last year, you may remember that we had added an employment title that was Other DREAMS. And then we also had asked folks to specify in the comments if individual works primarily on DREAMS. Those were both really, I would say, Band-Aid solutions. They weren't ideal. With the employment title, it meant that you had to make a choice of either identifying this individual as a DREAMS support staff or maybe giving their employment title that's more accurate. And we don't want you to have to make that choice. And in the comments, it's just it's a messy way to identify. So this is very exciting that we now have a column that specifically identifies DREAMS programming staff. And it means that you can select the employment title completely separately, just select the employment title that most accurately describes the work that individual is doing, and then in this new column, say yes or no if they primarily support DREAMS. If you are if you're working on a mechanism that has no DREAMS programming, or even maybe you're in a country that doesn't do any DREAMS programming, no worries, you'll just select no for everyone for that column. Okay, like I mentioned, we have made some minor changes to the IP program management definition under primary program area. Again, if you're in Zambia, you maybe remember the conversations that we had about this. We did a joint trip with our ER expenditure reporting colleagues to try to really figure out what's the difference between IP program management for HRH versus ER, and why are they different? And I think that we decided they don't need to be different is really the answer. So we have worked to align those definitions a little bit better, and we'll have later slides that give the definitions. We've also expanded the seconded to MOH field to give an additional option for staff who maybe are supported by PEPFAR, government staff supported by PEPFAR in all or in part, but are not at the MOH. And then we've also expanded the field that was formerly the position is based outside of the OU to allow some more detailed options. And then finally, we have refined the primary beneficiary options to match the update to the expenditure reporting beneficiary options. Okay, so we're now going to go through each of the elements in the template. We will spend less time on the ones that haven't changed. So I recognize some of you may be reporting for the first time this year, so we won't skip over them completely. I also just want to really note that each of these items is explained in detail with definitions and examples in the HRH Inventory Handbook. I don't know that the updated handbook has been uploaded yet at the link you all have, but it has been updated, so it should be happening in the next few days to maybe week, but definitely before October 1st. So I think that will be a really great resource, and we do have it linked in the slides, but just want to plug that quickly. And you can also note in the slide, in the bottom left corner of this slide, there's a little legend or little key where you can see that none of these first few fields have been changed. So for the ones that I've mentioned on the last slide that have had changes, that will be noted there. There's a lot of slides in this deck. So when it's shared out and you're flipping through, if you want to really skip ahead to the ones that have been changed, you hopefully will be more easily able to do that with this legend. So we're going through in order of where the column appears in the template. So the first column in the template is the record number. This is included in the template, but it's not required, and we really recommend that you don't bother to put in a record number. It's not something that we look at ever, so you can leave that one blank. The next one is if the staff member is employed through a prime or sub IP. So if you are a subrecipient reporting out, you would say sub. If you are a primary partner, then you would say primary. If you are subrecipients, so you would have said sub in the last field, then you'll want to put the name of the subrecipient. This will be from a drop-down list. So again, important to have your correct template to have the right drop-down list. And then the next field is gender. So you have quite a few gender options to choose, and this is for that worker. I just want to note that I'm seeing that there are questions coming in the chat, and I think Kyle is answering quite a few of them as they come in, but we will also have a Q&A, a pause for Q&A after we get through all the fields. So we're not ignoring your questions if you're adding them. Okay, so the next thing you'll see in the template is service and non-service delivery. So this field did not change, but it did move forward. So like I mentioned, it used to be a little bit later in the template that you would get to this, and now it's one of the earlier fields. So what you're selecting here is if this individual, their primary work, so most of their time is spent providing direct services. So that means direct interaction with beneficiaries, with patients, clients, et cetera. That includes obviously in-person interactions, but it also, if someone's working primarily in telehealth, so they're speaking with beneficiaries on the phone or over an app, that would still count as direct service delivery. If you select direct service delivery, so this is a change from last year. If you select direct service delivery, then the following field, employment title, you will only see employment titles for clinical and ancillary staff. You're not able to select direct service delivery for a staff member who provides like program management, primarily program management employment title, or any other like above site employment title. So hopefully that's clear, and when we see some examples, it will be helpful. So the non-service delivery is the opposite of that. So this is staff who primarily are not working directly with clients or beneficiaries, but they're doing work that really supports the programs themselves. So maybe like technical advising or providing, like HR support, anything like that. So that would include all the program management staff as well as like most of the TA staff and other professional staff. By definition, if they're above site, then they are non-service delivery. Like I mentioned, sometimes there will be staff who do both. So maybe they spend part of their time directly providing services and part of their time advising others, providing like technical advising. You want to look at the time, how they spend their time, and then choose what they spend most of their time on. So if they're 40% providing direct services, 60% non-service delivery, you will choose non-service delivery for them. And for their employment title, you will choose the employment title that corresponds to that non-service delivery role that they're providing. Great. Okay, so then the next element is employment titles. So you can see it's orange because we've expanded employment titles, like I just mentioned, and I think I saw hearts hopefully in reaction to this, so that makes me feel great. If we've made a change that will make entry into the template easier, the employment title list is now going to update based on if you've chosen service delivery or non-service delivery. Something really important to note. Employment title, it's not about what the training or the qualifications of that staff member is. It's about what their actual day-to-day role and responsibilities are. So if you have a medical doctor, and maybe even in your own system, their title is doctor, that's fine. But if they're spending most of their time not providing direct services, not using their training directly with beneficiaries, but instead they are technical advising. So they're advising other doctors one step removed from that direct service delivery, then you would need to choose an employment title that corresponds to technical advising, not doctor. Even if doctor is their training, doctor is their title in your own system, that's fine. They are a doctor, we're not taking that away from them. But for the HRH inventory, we want the employment title to correspond to most closely to what they're doing in their day-to-day role. Okay, so this is just to emphasize what I just said. So another example, a nurse who provides facility management administration, they're not providing nursing services, or maybe they are providing nursing services, but it's the smaller piece of their time, not the majority of their time. In the template, you would want to report them as a facility administrator, not as a nurse. Hopefully that's clear. So this is a list of all of the employment titles that are available in the drop-down list. So the two direct service delivery categories are the healthcare workers clinical, the healthcare workers ancillary. So clinical would be, your doctors, your nurses, pharmacists, psychologists, etc. The ancillary field would be a lot of the community health workers, peer educators, roles like that. And all of these are folks who are directly interacting with and providing services to beneficiary. Then the column on the right, we have other staff. So these are the non-service delivery staff. That includes IP program management. So you can see this was a change that was made last year. So hopefully those of you who are reporting not for the first time will recognize that IP program management and then the more specific job title. And then it also includes other professional staff. So like that last example, facility administrators, things like M&E officers, data clerks, etc. And that's also where you will find the 3 new employment titles that I mentioned. So that district coordinator, program manager officer, and program coordinator assistant, they are falling under other staff, other professional staff. You also can see that I've crossed out the other dreams because, like I mentioned before, we have removed that as an employment title. We don't need it anymore since now we can identify dream staff using that separate dreams column. Instead, you will just choose the job title or the employment title that actually describes their work. You do still have dreams mentor as an option. So if they're a dreams mentor, choose dreams mentor, choose yes, but you can also, if someone is like a community mobilizer who works primarily on dreams, you would select community mobilizer for their employment title and then yes in that dreams column. Hopefully that's clear. And all of these employment titles have definitions with more detail in the HRH inventory handbook. So if there's any confusion, please reference the handbook. And also if you are looking at this list and you're saying, oh, I know that staff who work on our mechanism, they don't have any of these titles, they don't fit under these titles, then I would recommend as a first step that you look in the handbook and check, do any of these titles, when I read the definition, do they describe the work that that staff member is doing? If yes, then select that title. So just highlighting here these 3 new other professional staff titles that have been added. Okay, so if you don't see the employment title that you think describes a staff member in the list, you check the handbook and you still don't see something that describes that staff member, you just don't see a fit, then there are these other options. So if you have someone who's providing clinical services, they're not a doctor, they're not a nurse, and their role doesn't fit into any of these definitions, after you check the handbook, as a last resort, then you can choose other clinical provider not listed. Similarly, for ancillary workers, we have other community-based CODR. And then under other staff, we have other program management staff, and we have other supportive staff and other professional staff. We do just want to encourage you to not default to these other categories too quickly. Like, really make sure you've done your due diligence, you've checked the handbook for definitions, you're very, very sure that no other employment title will work before you select other. The reason for this is because when we're looking at the data, when we're trying to use this data for planning, for thinking about sustainability, for really understanding our footprint, when we have too many staff in these other categories, we just don't really know what they're doing. We don't actually know what their role is. So it makes it much more difficult to use the data. And I think it can also sometimes give a false impression of how you all are using your funds for staffing. A big example is this other program management staff. We sometimes see much higher numbers than we would expect of individuals who are labeled other program management staff. That doesn't mean you shouldn't have program management staff. You should. Program management staff are important. There need to be people employed to manage the mechanism, manage the award. That's very important. But sometimes we have heard that there are staff who are, for example, managing the technical or programmatic side of a project. They didn't fit anywhere else. And so you best guess, place them in other program management staff. We're hoping with the addition of these new employment titles, the program manager officer, program coordinator assistant, and provincial district coordinator, that will help you to pull some of those out. So they're not being misidentified or intentionally, but maybe not best match put into IPPM. Hopefully that's clear. And I'm hoping that when we get into a little bit more detail with the definitions, that will also help. Okay, so knowledge check. You have a medical doctor by training, but they're working on your program as a technical advisor for HIV care and treatment. Should you select doctor or technical advisor as their employment title? And please drop your response. Yes, we've got a ton of Bs, and that's absolutely correct. You would select technical advisor. Amazing. And even if they still are, providing direct services with some of their time, but it's the lesser part of their time, you would still select technical advisor. Great. Okay, so now to our exciting new column. So this is just, I don't know if I can even say how happy we are to have this column added. We really wanted it added last year, and I think there's very, very well-founded hesitancy to add columns to the inventory. We totally recognize that it's already, it's a lot of information that we're collecting. It takes a lot of time. So we would not ever want to willy-nilly add new columns to the inventory. But we felt like this one was really, really important, especially for USAID, because for USAID, we do a lot of dreams programming. It's a really big piece of our work in a lot of countries, and it's a very important piece. And we were just having a really difficult time identifying the staff who work on dreams programming with the way that the data was previously reported in the inventory. So we're very, very excited to see this now this year. So the column title is primarily supports dream programming. And like I mentioned, your answer options are yes or no. So it replaces that other dreams employment title, and it also replaces our request to you all, which many of you did, so really appreciate that from last year, to use the comment section. You no longer need to specify in the comments if an individual primarily supports dream programming. Don't need to do that anymore. If, like I mentioned before, if you don't have any dreams programming, if you're hearing me and you're like, I don't even know what dreams programming is, that's fine. Just select no. If this is only applicable, the yes will only apply to mechanisms and individuals who are primarily supporting dreams programming. Great. Okay, so the next column, and again, this one is not new, but it did move forward a little bit. So it's earlier in the template, and that's primary program area. So this is going to be the primary area that the individual works. I know that a lot of people, a lot of staff work across multiple areas. That's great. That makes sense. For the inventory, you will only select one, and it's where they spend most of their time. This is different from ER. In ER, in the expenditure report, you're much more able to divvy up, like if someone works 50% of their time on care and treatment and 50% of their time above site, injection safety, just reading off the screen, you can tag both of those pieces in expenditure reporting. In the HRH inventory, you just need to pick a single primary program area. So we can't do that division. Another thing to note is that only workers who support community or facility can select a site level program area. So when you look at the options, the drop-down list for primary program area, you'll see some of them are labeled above site, others are IP program management, and then others are site level. So if you have chosen above site, if you have chosen non-direct service delivery and then an above site employment title, then you will not be able to select a site level program area. You need to select an above site program area. I think that this is also a little bit of a change for this year. The intention is to help simplify and help people find the correct program area to select for the staff. But if there are any questions or confusion around that, really encourage you to ask them. We will, I'm sure, include some more details and examples in our Q&A document that we'll send out. And also there are some in the handbook as well. Okay. So like I mentioned, I think I alluded to this earlier, the only little refinement that we have made for primary program area is around this IP program management. So we historically have had a bit of a different definition for program management than the expenditure reporting. For expenditure reporting, program management can only refer to duties or staff that are supporting and managing the award or the mechanism. Previously, that was different for HRH. For HRH, you could have someone at like a facility who's managing more technical work. They could also be program management for their primary program area. That got very confusing. I think it got confusing for all of you who are entering the data, and it definitely got confusing for us when we were trying to look at the data and look at the data next to the expenditure reporting data. So we have refined the definition so that the IP program management program area, and it does say IP program management, not just program management, that should only be selected for individuals or for staff whose work is going towards managing the award. So if they're a different kind of program manager, so they're maybe going to be assigned one of those new employment titles, like they're a district coordinator. So they're coordinating a program across an entire district. They're doing a lot of the roles or the tasks that you would associate with program management, but not for the mechanism, not for the award, for technical work, then you would need to choose a different above site program area for them. IP program management is only for people who are managing the award itself. Hopefully that's clear. If you work also on expenditure reporting, then you can just use that same definition that you had applied before to expenditure reporting. And we do have some examples later on and in the handbook. And again, if you are from a Zambia partner who I met with a few months ago, apologies, this is different from what I told you then. But that's because we heard your feedback and we heard how confusing it was to have these definitions be different. So we made this change from the feedback from all of you and as well as other partners and POCs. So hopefully this will help and actually make things simpler and clearer. Okay, so here's an overview of your program area options. Again, all of this is in the handbook with definitions. So at the site level, you have different prevention, socioeconomic, testing, and care and treatment options. So for example, if you choose care and treatment HIV/TB, then that would refer to someone who's primarily providing clinical services related to HIV/TB care at the site level or community level. These above site program area options would be someone who's providing, primarily working not at the facility, not in a community, but at a above site level, so across different areas. If you have a staff who's roving, So they maybe work at more than one facility, but they're going to individual facilities providing these services, then you can still choose a site level program area. It's just for folks whose work spans across facilities, across districts, et cetera, that you would choose above site. So these above site program activities are like more technical assistance activities that are aimed at strengthening the health system in different areas, that kind of thing. And then the final area is this IP program management, which we just talked about. So you can see here that it's just administrative and planning activities for implementing the award. So that includes planning, coordination of the award, et cetera. So you'll see if it's not directly for the award, directly for the mechanism, then you need to choose a different program area, not IP program management. Okay, and I think I'm like glancing at the chat, and I think that Kyle already highlighted this in the chat, and I mentioned it earlier as well, but important to note about about primary program area in the inventory is that you can only choose one. So even if someone works across multiple program areas, just choose the one that's the best fit, and then report that one primary program area. So then this example given on the slide, what if you have a nurse who spends 3/4 of her time on HIV care and treatment, 1/4 of her time on HIV testing? You would report her just on one line of the template, even though her work maybe feels like it could be spread across 2 lines. Remember, each row, each line is one person. And you would report her primary program area as general care and treatment, because that's what she's spending 3/4 of her time on. So hopefully that is clear. Okay, moving on. So the next data element in the template is this technical assistance staff. This is not changed from last year. It again just has moved up to be a little bit earlier in the template. Oh, I'm so sorry, my slide's coming off a little bit, but it is not changed. So, oops, there we go. So this is just if a staff primarily is supporting and improving service delivery, but they're not directly interacting with patients or beneficiaries. So if you chose direct service delivery previously in the direct service delivery column, then you would probably choose no for provides TA, and vice versa. If you've chosen non-service delivery, they don't necessarily provide TA, but they may be TA staff. So that would be things like they're doing trainings for other staff, for other maybe direct service delivery staff, like workshops, or they're providing like expert guidance. So maybe they're really like the expert on an area of testing or something, and they're providing that expertise to direct service delivery providers or to the program itself. Yeah, so there's some more examples here, like monitoring evaluation advisors, supply chain advisors, health financing advisors, et cetera. Those are likely technical assistance staff. Get a sip of water. Okay, so then the next element, this one again has not changed from last year. So that's the mode of hiring. So here you will specify if the individual is hired under a salary. So that's PEPFAR funded compensation for workers who are employed by an IP and receive a salary or a wage. If they are employed as a contract employee, so that means that they are receiving their compensation through a contract, but they're not directly employed by the IP. They're contracted to perform specific services. And this includes stipends. So if you have someone who's receiving a monetary stipend, then that would be considered a contract employee. And then finally, you have non-monetary only. So this would be like if they're receiving a bicycle or phone cards. It's more likely you might see this in some of the ancillary workers. It doesn't include, so that bicycle example, if the bicycle is for them to perform their job, then you would not include that as non-monetary compensation. It's only if it's in exchange for their work. To note with non-monetary, so I know that we are trying to move away from non-monetary, like we really believe that health workers should receive compensation for their work. But we do encourage you, if that is how staff are being compensated, please try to accurately report it in the inventory. It's important to know, just to know what's going on, know what that looks like. I know it can be a little bit more difficult to report non-monetary, so we appreciate your efforts to do that accurately. Also note, these are mutually exclusive fields. So if someone is a salaried employee, but then they also receive some, like sort of non-monetary compensation as well, you would select salary. So they can only be put into one of the categories. You cannot select more than one. So if they receive more than one, you will pick the highest on the list. So salary first, then contract, and non-monetary. Okay, give me 1 second. All right, I'm not used to speaking straight for such a long amount of time. So the next element is MOH staff. So this one we have expanded a little bit by adding one additional answer option. So previously, the question in the template was MOH staff or seconded to MOH. And then your response options were no, if they're not MOH staff or seconded to MOH staff or seconded. And this was for someone who is supported by PEPFAR, supported by the mechanism, but they're officially designated as like MOH staff, or they're seconded from PEPFAR to serve in that capacity with the MOH, right? So what we've changed for this year is we've changed the column heading to government staff or seconded to MOH. We've kept the first three options the same as previously, but then we've added a third or a fourth option, which is yes, other non-MOH government staff. So this would be staff, for example, who are supported by PEPFAR, but work for the government, but maybe not at the MOH. So if you have staff like the Ministry of Finance or Ministry of Education who are receiving PEPFAR support, but they're not MOH, then you could select yes, other non-MOH government staff. So hopefully that will, I think this had been an issue previously where there were some staff who fit this criteria and they did not have a good place to put them. So hopefully this will respond to that. Okay. I promise we're getting there. We only have a few more fields to go. So next we have the months of work. This is not changed from last year. So this is based on the fiscal year. So that would be for FY24, you'll be reporting on the fiscal year that started October 1st, 2023, and then ends in a couple weeks on September 30th, 2024. So if someone was hired midway through this fiscal year, then you will want to report the actual number of months that they worked. So maybe 6 months if they were hired in March, Similarly, if they left their role before your reporting, so maybe they were working on October 1st, 2023, but then they quit or were fired or, they're no longer working under the mechanism as of September 30th, they quit, let's say in August, then you would say 11 months. So just the number of months that they're actually working with this PEPFAR support. If they worked for part of a month, then just count the number of weeks and you can include a decimal. So if they worked like 2 weeks into August, then you could say 11.5, or sorry, that would be 10.5. Or if they worked, 3 weeks, you would say 0.75. You don't need to get down to the days. It's fine to estimate just a little bit, but get as close and as accurate as you can to the week and enter that as a decimal. Okay. Next, we have the average full-time equivalent, or the FTE. So the goal of the FTE is to give us the ability to count not just the number of individuals supported by PEPFAR, but also the amount of full-time equivalent, or the amount of work that's also being done. So this would be 0 to 1 is what you would be entering into this field, with 0 being someone who didn't work at all under PEPFAR, and 1 being someone who worked full-time. No work on average, and this is on average per month. 1 would be full-time work. So only enter the FTE that's supported by PEPFAR. So if you have a staff person who, for example, maybe 50% of their time is supported by PEPFAR, and then 50% is supported by the MOH to work on other things, or even the same things, but it's supported by MOH, you would enter their FTE as 0.5. Even though they're a full-time employee, we only want to capture the portion that's supported by PEPFAR. So here are some examples. of what FTE you would enter for different kinds of workers. So like I mentioned, if you have like a worker, a PEPFAR worker who works pretty consistently, like the same number of hours per week, and let's say you have a nurse who works 20 hours per week all year long consistently, you would enter 0.5 for her FTE because 20 hours is half of, we're considering 40 hours a one FTE, a full-time work week. If you have someone whose workers are generally consistent per month, but they might vary within a week, then like say, for example, you have a case manager who works 50 hours every month all year long, then that would be 0.289. This math is getting more complicated, but don't worry, that's what that third tab of the template is for. It will help you calculate this, so you don't need to pull out your calculators and do this yourself. But this is just to note that if you have someone whose hours aren't consistent within a week, but they are within a month, that's also an option. And then if you also have, you can also have a worker whose hours differ per week in a month. So like a data clerk who works 40 hours for 3 weeks and then 20 hours for their last week of the month, then they would be 0.875. And again, the template FTE calculator can help you with this math. And then you also might have workers whose hours vary even month to month. So maybe they work 40 hours per month from January to March, but then that's it. They don't work anymore. Or maybe they increase from 40 to 60 hours then after March. So these are all scenarios that you might run into. And they're all something that the FTE calculator is prepared to help you calculate out that average monthly FTE. So this is just a screenshot of what the FTE calculator looks like. And it's a little bit hard to see. It's a little small. So we've pulled out the just option 1. So this is that worker whose hours generally remain constant per week. So the first, for everyone, you would enter the number of hours in a standard full-time work week. So I gave the example of a 40-hour work week, but maybe in your country, you're lucky and you have a 36-hour work week that's considered full-time, then you can enter 36 there instead of 40 or anything in between. So that just depends on what's considered full-time work in your setting. And then the following calculations will be based on that full-time work. And then for example, with that nurse who works 20 hours per week, you would enter 20 in the yellow box. And if you had entered 40 in the blue box, then it would calculate out for you that average monthly FTE of 0.5. So I encourage you, go ahead and download the template, or if you did this last year, the FTE calculator has not changed. Play around with it a little bit, make sure it makes sense to you. If not, please feel free to reach out to us with questions, or your POC at the USA Admission for questions. We want to make sure that this is not too arduous of a process and that the tool makes it as easy as possible. Okay. The next data element is primarily supports the work in the community. Sorry, I think there's a word missing there. I will add that before we share the slides. So this mostly refers to ancillary staff delivering or supporting the delivery of non-facility based activities at the community level. So some examples that we often see are like community health workers, peer educators, dreams mentors, community mobilizers, etc. Almost anyone you would see under that list of ancillary healthcare workers, ancillary, would probably be a yes to this primarily supports work in the community. But you might also have doctors or nurses who primarily are working in the community. So it's really not a one-to-one alignment with the employment titles. We do have a more complete list of roles that you might see as primarily community-based in the handbook. If you click on this link from the slide, it will take you directly to that list. One change that, again, this was in response to some feedback that we received. Previously, if you selected yes to primarily supports work in the community, you were not able to enter a facility in the template. That meant for the template that individual could not be entered with a facility in the facility field. We've changed that now. So if there are individuals who are primarily supporting work in the community, but they're also attached to a facility, you can report that facility. Hopefully that will make it a little bit clearer when you're doing the reporting. Just note that If it's a community health worker, but they're working at the facility, or sorry, a peer educator, but they're working at the facility, not in the community, then you would select no here. So you want to really think about where is their work taking place. Okay. The next element is for roving staff. So this is PEPFAR supported staff who work in multiple facilities on a regular basis. So it's not the same as above site. Above site would be staff who are maybe doing technical advising or thinking like more at a planning level, at an above site level, maybe health system strengthening. Roving staff are staff who do facility level work, but maybe just at more than one facility. So maybe they're a nurse who visits one facility 3 days a week and another facility 2 days a week, then that would be roving staff. They only would be associated with site level program area. So if you pick a program area that's above site or IP program management, that would not be a roving staff, that would probably be an above site staff. Okay. All right. Next element we have, so this one has changed a little bit. So previously we had the element, is this position based outside of the OU? We have updated that a little bit to add some more detail. So we've changed it so that it's now called, where is this position based? And then the options that you can choose from are outside of the operating unit. So that would be the folks who you last year or before would have selected yes to primarily based outside of the OU. But we've also added an option to add staff who work at the national level, and then as well the subnational level. And the subnational level would include district level staff, but it would also include facility or community level staff. So likely the vast majority of the individuals you're entering would be at the subnational level. So an example of a staff who would work outside of the operating unit or international would be like US-based staff that spend a portion of their time supporting a project or mechanism and billing directly to that mechanism. And for those staff, you will leave all of the geographic hierarchy. So that's the columns highlighted in blue. You would leave those all blank. You would just select a country. For regional programs, so like OUs that include more than one country, like West Africa region, et cetera, you would select a country in the SNU1 column, but leave all the rest blank. If you're already an operating unit that's just a single country, then you will leave all of them blank. So this new addition of national level staff, so that would be staff that work at a national or like an operating unit or country level supporting national level activities. So you can select the SNU1 where the majority of the work is performed. So like if the capital or administrative capital, but they cannot be considered site level staff. So they have to be above site or PM if you're selecting national level staff, same for outside of the operating unit. And then finally, like I said, some national level, that will be almost everyone. So that's all of your community facilities level staff, as well as staff who are working at like a district or lower level. Okay, so the geographic hierarchy, this also has not changed. This is, like I mentioned, the very, very beginning, the one spot of the template where you may leave some fields blank, depending on what you've selected for those earlier fields. You want to, when you're filling out the geographic hierarchy, you want to select based on where the work takes place. So not necessarily where this person their desk is located or where they're sitting at a computer, but where the work that they're doing is playing out, okay? If someone works in more than one location, but they're still like community or site level staff, then just pick where they are spending most of their time. That's the thing you'll hear throughout this HRH inventory reporting guidances. Think about where they're spending most of their time and choose that as your option. If it's exactly 50%, then flip a coin or choose alphabetically. Hopefully it won't be too common that you'll have one that's exactly 50-50, but you'll still need to just choose one. So you'll start, it's very important that when you're filling out this template, you start with the furthest left column, and then go to the smallest, because the drop-down options will be limited based on what you choose in the larger geography, and then it will help you to populate the relevant smaller geographies. So the hierarchies are going to look different based on your operating unit. So some of you may be looking at this and say like, wait, this doesn't look like how I am used to the geographic hierarchy looking. That's just because this example maybe is from a different type than the one that you have. So like I mentioned, if you are a regional operating unit, then you will have an OU field where you will select the actual country that you're working in. If you're already an operating unit that's single country, you don't have to select that. It will populate for you on the back end. Then you may have SNU1 field, a PSNU field, community field for some templates, not all, and then a facility. Everyone will have a facility. Okay, so here's just a definition of all of those geographic units that I mentioned. So the SNU is a subnational unit. It's just whatever is one step lower than the country or than the operating unit itself. So for regional operating units, that might be a country. For country operating units, it might be like a province or a state, depends on your country and how they do their geography. The PSNU is a priority. The P stands for priority SNU. So that's the geographic units at which PEPFAR sets their program targets. I'm sure most of you probably know what that is for your own situation. The community, which some OUs will have and some won't, is a geographic area or unit that's higher than facility level, and it's sometimes the same as the PSNU. So if it's the same as the PSNU, you don't need to enter it twice. It's only if it's not the same that you would see that in your template. And then finally, the facility is the lowest level that we get to. I think hopefully it's pretty clear what a facility is. Okay, so this is just an example of how these map to the SNUs, the subnational units. So for example, Malawi might be your operating unit. And then you would have your SNU3 would be your PSNU and community. They're not separated out for some operating units like Malawi. And then your SNU4 would be facility. So you can see it just kind of depends how you skip around. And we'll have some more examples. So for like an example for Malawi, this is what it would look like. Okay. So here's where you can find what your operating unit or your country would look like. So you can see at the top, so template number 1, where the PSNU and community are combined, so they're not different, like the Malawi example we just looked at. You can see the countries listed there. The other option is you might have the PSNU and the community separated, so that's the next set of countries in blue. And then finally, for those regional operating units, so Asia regional, Western Hemisphere region, and West Africa region, you will have that separate country column that you'll fill in. And hopefully when you're looking at it for your own template that is designed for your operating unit, it will be a little bit clearer. Okay, so when you're completing the template, you do need to fill out the geographic hierarchy to the appropriate level based on what you've entered previously about this person. So if you have said that they are operating outside of the OU, then you'll leave most of them blank. If you said that they're a site level employee, you will need to fill out the geographic hierarchy to the facility. So it's just going to depend on what you've already entered for this individual. And remember, like I said earlier, the location of the work is where they're performing their work, not necessarily where they're sitting, but where the work is happening. So here's a little bit more detail about this first option. That's the OUs with the PSNU and community combined. So you can see for outside of the OUs, like I just said, all of those are going to be blank. The no means you're not entering anything. For national and military, you'll just enter an SNU1. Above site, it will kind of depend on some other factors, but you'll mostly leave it blank. Community, I need to update this as well, because community, you will enter an SNU1, a PSNU/community, and you now can enter a facility. You don't have to, it's not required to enter a facility, but if that community health worker or community worker, ancillary worker is attached to a facility, you can now enter it. Roving across facilities, you would go down to the PSNU community. You don't need to pick one facility because they're roving. They're going across multiple facilities. So just pick the community or the PSNU where those facilities are located. And then finally, facility level, you would enter information all the way down to that facility level. I won't go through quite the same detail for all of the other examples, but please feel free to look at these later when we share the slides. It's pretty similar, but just some more levels of detail based on the geography in different countries. And then finally, for the regional hierarchies, some of these will not actually be options available. So you might see some dashes, which means that you don't even need to worry about it. But the main thing to note about the regional OUs is that you do need to select a country for anyone who's even someone operating outside of the operating unit, select the country where the mechanism and where the work is happening. Okay, so finally, another knowledge check after a long stretch of me speaking. So for community workers not attached to specific facilities, how would you answer the question, does the staff work in or support multiple sites? So this is a tricky one. It's not necessarily roving staff, because roving staff would be working in specific facilities. It's a community worker. All right. So we've got B. A lot of people are saying no. Does the staff work in multiple sites? And they are correct. Yes, we would say no. Staff are not working only at the staff that are working only at the community level and are not attached to a specific site. They would not be roving. Hopefully that's clear. I know that roving can sometimes cause a little bit of confusion, but hopefully that's a helpful example. Okay, so summary of the work locations and how they are aligned with the primary program area. So if you enter a primary program area that's above site or IP program management, the location of that work will always be above site. If you enter a program area that's site level, so that would be care and treatment, HTS, or community workers, then they would be at the community roving staff or facility level. Okay. So our next column is primary beneficiary. So this one, again, has been refined, and that is just in response to some changes from the expenditure report. And we previously were directly aligned to expenditure report for primary beneficiary, so we wanted to stay aligned. So we also changed to match them. So if you are used to it, if you've reported previously, you might look at this list of primary beneficiary options and say, oh, that looks shorter. And you're correct, it is shorter. We have removed some of the previous options and then also added, for example, military. But you might notice that priority populations is no longer an option. We will be on the back end doing some mapping. We won't lose the previous primary beneficiary data that you've entered, but we will map it to these categories as well. So someone who maybe previously worked with the priority population primary beneficiary, if those priority populations they were working with were military, then you would select military, obviously, now going forward. If they were for example, clients of sex workers, you see that there's no longer a specific beneficiary that they would fit under, so you would just need to select non-targeted populations. And we have a mapping that we've done between the old and now the current options that we will include in the Q&A document. And also in the handbook, you will be able to find that. Okay. So the next data element is this public health emergency. So some of you may remember this was previously about if the staff member had worked on COVID, and now last year we changed it away from being COVID specific to a more general, if they've supported delivery in response to a more general public health emergency. And this is at any point during the reporting period. It doesn't have to be the primary use of their time. Just did they support this public health emergency at all at any point? Yes or no. And so the examples are like, yes, it could be COVID-19, but it also could be like Ebola outbreak or cholera, anything like that. Okay, so very exciting. Now we're moving into even more the pieces that are connected between HRH and ER. So that is the expenditure. So we do collect the expenditure, and I think that that's an important language difference to note that we're not saying salary, we're saying expenditure. So it's the same as the ER expenditure. It's looking at how much was spent in the last fiscal year, not calendar year, on the PEPFAR supported worker. We don't collect the annual salary. So if someone collects an annual salary of $10,000 a year for easy math. But during that fiscal year, they maybe only collected $9,000 because they started later in the year, or they used to make a lower rate. You would enter $9,000. So it's not their annual salary. It's what was spent in that fiscal year on that individual worker. So what we do to collect this information is we collect it in 3 separate columns. So one is the total expenditure. So that includes fringe, that includes non-monetary. That's every cent that was spent in support of this individual. And then we also separately collect their fringe expenditure and then also their non-monetary expenditure excluding fringe. So here you can see the fringe column. So it's now column Z. So that's the total amount expended on the individual, including everything, like I just said. Please make sure to report this in US dollars. We definitely sometimes have people report not in US dollars. I know that it is potentially an annoying extra step. We do have the guidance on how to do the exchange to US dollars that I'm sure is linked in the handbook. We'll make sure to include that in the Q&A document as well. We just ask to pay extra attention if you see something that from one IP or one sub-beneficiary and you're like, wow, those salaries look really out of line with what we'd expect, or sorry, not salaries, those expenditures look really out of line with what we'd expect or with the others in this OU, please flag it, check, make sure that you are exchanging to US dollars. And we also will check it on our end during the cleaning window. Okay, so then the next column for expenditures is that fringe expenditure. So we want that pulled out separately. This is often applying to salaried workers, potentially contract as well. So that's anything that the employer is paying for in this sense that PEPFAR is paying for. That would be like health insurance or paid vacation, anything like that. So anything that's not direct payment to the staff member, not non-monetary compensation, but these fringe benefits. Okay. So here's some more, yes, here's some examples of fringe expenditure. So it's the things like authorized absences like vacation, sick leave, et cetera. It's things like contributions for us in US Social Security or like whatever your equivalent might be, insurance, health insurance, worker compensation, anything like that. And then also if there are work benefits like a housing allowance or anything like a salary adjustment based on location, that would maybe be a fringe benefit. Or not a adjustment, but like a rural housing, anything like that. It doesn't include stipends. We already mentioned that. Those should all be entered into the first column, the last column with the total expenditure. Stipends would go there, any cash awards, anything like that. It doesn't include like funds that are going to the facility itself, anything like that. Or like, yeah, so anything, you can read through these examples. And these were these would also not include indirect costs. So what you might be entering in the expenditure report as indirect, that would not count here. It's just the fringe benefits that are going directly to this employee. Okay, so the non-monetary, and so I think that non-monetary can be a little bit tricky. So non-monetary would be things like phone credits or like t-shirts, if you're giving out t-shirts, but not t-shirts that are required for their job, but more as like a reward, here's a t-shirt, that kind of thing. So yeah, household goods. So like if you're giving, a copper pot to a community health worker in exchange for their work, they're not using it for their work, but it is like given as compensation for their work. So that last bullet point. So don't include supplies that they need for the job, even if they can take them home after, but just things that you're giving as compensation. So like I think I mentioned quite a bit earlier, you might have salaried workers who also receive who receive fringe benefits and also non-monetary compensation. It's possible. You might have salary workers who receive a salary and a stipend and a fringe expenditure, or just a salary fringe expenditure. So all of those would be salary workers, and you would need to enter the different amounts in the appropriate column for each of those pieces. Contract workers, you are more likely to have a contract worker who just receives, there's just the expenditure for their contract, there's no fringe. Maybe they even just receive a stipend, again, no fringe, but maybe they do have fringe benefits. That's also something we might see. And we also might see them get like a stipend and also non-monetary compensation. So just try to use this guide to think about where you would enter each of these different types of expenditure. And then finally, non-monetary. So if you select non-monetary as their mode of hiring, so that was previously in column F, you're only going to be entering non-monetary compensation. So if they have anything under salary or fringe, then they are not non-monetary only. So you need to go back and rethink what you entered for their mode of hiring. Okay, so it was quite a long time. So let's take a little pause and see what questions there are. I know that Kyle has been answering a lot of questions as we went. But I don't know, Kyle, do you want to bring forward any additional questions that you were not able to get to and we can answer them?
No additional, I believe I answered all questions in the chat. If you have any other questions, please feel free to just write down your questions in the chat and I will respond in the chat box. But yeah, we're happy to take any questions at this time.
Yeah, and are there any questions in the Q&A also, Kyle, that we haven't gotten to? I'm just scrolling through right now.
Yes. Hey, Risa, this is Geraldine. There's a couple in the Q&A. I've been responding to some in the Q&A, but I think there's a few that would be helpful to discuss with the group as well.
Okay, great. So I'm just looking now at the open questions in the Q&A. The first one I see is a great question about copying and pasting from other documents. So it is still true that you cannot copy and paste from, for example, an FY23 template or just like a Excel sheet that's been put together on its own separately. However, you can copy and paste from another copy of the FY24 template. So for example, if you are a Prime partner and you've had the subrecipients sending in the templates that they've completed for each of their employees or their staff that they're supporting, you can copy and paste from there into the, into the main template that will be submitted to Datum. So yes, you can copy paste, but only from other FY24 inventory templates. Hopefully that answers the question. Okay. Excuse me. If, for instance, a colleague from another program gives direct support to one of our USAID programs and charges the time spent on the program, will that staff be part of HRH as well? So if PEPFAR funds are used to pay for that colleague, then yes. If PEPFAR funds are used to pay, even if they are not always a direct employee of the recipient or the partner or the sub-partner, you would want to enter them. They maybe would be like a contract. Maybe they wouldn't be a salary employee. I think if that doesn't answer your question, please just type it in again and make sure that I was understanding correctly what you were asking. The HRH template, so I was told that it would be available yesterday, and I haven't checked to make sure. So it should be available now for download. If you don't see it yet, I will check after this meeting and make sure. If you don't see it yet, then I think this week it should be available. Hopefully it is right now. If a subrecipient has a fixed amount award and working on a milestone, they don't share their employee detail. So I don't, Geraldine, do you have an answer to that? I don't know that, though. I think that those employees are handled a little bit differently, but I might need to come back to this one and follow up. We might put this in our Q&A document because I don't want to give you a confusing answer right now. Geraldine or Kyle, do you have anything to add for that?
Yeah, I know that there's some particularities about how any staff that are supported through FAAs are reported. So we will make sure to include clear updated guidance on that.
Great. Yeah, thank you very much for that question. That's a really good one. Okay, what's the difference between a pharmacy manager and a pharmacist such that one is clinical and the other is other staff? Oh, that's a great question. So I think that the difference is that a pharmacist is someone who's interacting directly with beneficiaries. So like they're directly filling prescriptions, speaking with clients about their medication, patients, whereas a pharmacy manager would be doing more of the like behind the scenes managing of the pharmacy. So that's the piece of work where they're not actually interacting with clients. If someone is doing both, which I'm sure is frequent, where someone is doing that management piece, but also working actively as the pharmacist, then you would just choose whichever one describes most of their time. Okay, and Geraldine and Kyle, please feel free to jump in if you feel like I've missed anything with any of these responses. Where can we put M&E data staff who work at site level as HMI is this only above site category? Ooh, that's a great question. I'm going to also have to get back to you on that because yeah, that's a great point that there are data staff who work just at the site level. I think that we should be able to enter data staff at site level. So if that's currently not possible, then I will follow up on that and put that in the Q&A with a response for you. Okay, mostly prime orgs. Oh, sorry, was someone coming off mute?
I was just going to note, Risa, that my understanding is because other staff in that category, which many of the data worker titles would fall under, can be reported as either site level or above site level, then they would choose an appropriate site level. You know, for example, if they're supporting M&E and reporting related to the care and treatment program and efforts, then they would be likely site level care and treatment reported workers.
Yes, yeah, that's a great point. So for that kind of work like data staff, M&E, even though some of the new program management titles, if the work is focused in a certain programmatic area, then you would want to choose the primary program area that that matches or aligns to that program area. I will double check though to make sure that that's possible. These changes with the sort of narrowing what you can choose for above site versus site, they're intending to make this easier. So if we've overlooked some scenarios, we want to make sure that we don't want to make it harder for you. So I will double check on that and put it in the Q&A document so you can see some clear guidance there. Okay, mostly prime org staff should go in which category? So this is staff that's employed by the primary partner. So they would still go into the category that aligns with the work that they're performing. So if they are working for the primary partner and they're mostly doing management of the award or even like management of the mechanism side of the subrecipients, then they would be program management. If they're working for the prime partner, but they're doing like technical advising or more technical work, not at the site level, they would be above site, and then the same for site level. Hopefully that answers your question. Otherwise, maybe just resubmit it to make sure I understand correctly. Okay, would a technical advisor supporting a technical area across multiple locations be considered at site level or above site? So a technical advisor across multiple levels would be above site. So the site level is just if they're like roving between sites and providing more direct services. When will the template be available? Hopefully now, but if not now, within the next couple of days. How do you enter a lay counselor that works both facility and also goes in the community to mobilize clients for HIV testing and VMMC? Great question. So you would enter them with the employment title lay counselor, direct service delivery, and then you would need to just think about where the majority of their time is spent. So if most of their time is at the facility, then you would enter them at the facility and you would say no to primarily supports work in the community, because that primarily means more than 50% of their time. If more than 50% of their time is in the community, then you would say yes to that community question. And then you could also link or enter the facility as well. That's that change. But yeah, it's really based on, is it 3 days versus 2 days? Is it 5 hours versus 3 hours? You just have to think about where most of the time is spent. Will you provide exchange rate for conversion of the local currency to USD? I think yes, we do have that. I think ER has it, and it's linked in the handbook. I'm fairly certain. But that will also be in the Q&A document, so we'll make sure that link is there for you. What allowable okay, great question. I'm so glad that you asked this. So what allowable variation percentage of the monies between ER and HRH, and how is it calculated? Okay, so when we in the data cleaning window, we look at the total expenditure by like staffing category. For ER, we have primary program area. We can look at the beneficiary, and we can look at the like healthcare worker clinical, healthcare worker ancillary, those categories, and we do compare them. Kyle might need to jump in and tell me the exact percentage, but I think we flag maybe a 15 or 20% difference. Is that right, Kyle?
The ER and HRH dollars should mostly be similar. We're saying like maybe around 5-10%.
5-10. Okay.
It cannot be super wildly off. ER and HRH should be within relatively next to each other. They cannot be wildly different in the scale of millions, for example. Like they have to be maybe 5%, maybe 10, but they should be relatively close. They will not be exact, and sometimes they are exact, but they should mostly be within ballpark of each other. They should be relatively close to each other, like around 5-10% ish. But yeah, that should mostly be, but they cannot be wildly off, for example.
Yeah, thanks, Kyle. So we will flag during the cleaning window, it sounds like 5 or 10%, and we will share that information back to say, hey, can you just look into this? But like Kyle said, we expect them to be close. We don't expect them to be exact. And part of that is because, for example, for primary program area, you can only pick one in the HRH inventory, and you can pick multiple in ER. So that is going to lead to, for example, someone who spends 40% of their time on a secondary program area in HRH, all of their time is going to be, or all of the expenditure is going to be put towards that primary program area, versus in ER, it will be split apart. So we think it is more accurate if they're not exactly dollar to dollar the same. However, we don't expect them to be very, very different. That would flag for us like something might be wrong. So when you get a list from us during the cleaning window, or also when you're providing your own checks, maybe use like a 5% threshold, and then just check and say, let me make sure this is right. Maybe it is, and maybe that's fine, or maybe something needs to be corrected. And we'll make sure to have that disclaimer when we share that out after the cleaning window. Okay, next question. If you have USAID funding and CDC funding, do you have 2 inventories for each fund, or do you do HRH inventory inclusive of both funds? So the templates need to be completed at the mechanism level. I don't think you will ever have a mechanism that is USAID and CDC together. Geraldine can correct me if I'm wrong, but I don't think so. So you would need to fill out separate templates for USAID and CDC, and then submit those to the appropriate partner. If you're a sub, if you're already the prime, then you would need to complete a template to upload a datum for each mechanism on its own separately. We do so GHSD does combine them. So there's only one HRH inventory in the final product. So they'll be in the same data set, but for reporting, you need to report them separately. Okay.
Yes, that's right.
Okay.
And because I was just going to note, because it's at the mechanism level, it would always be a separate mechanism through which you're receiving funds from either USAID or CDC, even if it's you're the same, it's the same implementing partner organization. And then you would report appropriately for each mechanism.
Yes, exactly. Perfect. Okay. In the instance of an intern hired under a stipend, would you place them under contract or salary? I believe that, sorry, now I want to go back in the slides to double check, but I believe that a stipend would be a contract worker. So if they're a stipend worker, then you would put them under contract. So great question. So I would normally drop the HRH reporting manual into the chat, but it has not been updated at the link yet. We do have a final updated handbook, but we're waiting on GHSD to upload it to the link. As soon as it is there, we will send it out and make sure that you get your hands on it. It will be the same link as last year. So if you had it last year, if you click on that link now, I'm sure you see it still says FY23, but hopefully later this week, you will see it saying FY24 and it will be updated with all this new information, but we will make that very available to you as soon as it's there. All right, thank you. Those are amazing questions. Really appreciate them. Please keep them coming. I know that we're 15 minutes to go. Time has flown for me at least. So let's keep going. So we're just going to very quickly go through some examples. I'm not going to spend too much time in here because I want to make sure we have time to get to the piece around your datum account. So I think I'm going to go through just 3 quick examples. So when you get the slides though, you will be able to see we have some more scenarios that I'm not going to share right now in the interest of time, but you can look at on your own if they're helpful. Okay, so let's say that we have an HRH advisor who is seconded to the MOH. So she's a female HRH advisor. She's employed through a prime partner, and she's seconded to the Ministry of Health to support the development of a new national HRH strategy. So she works in the Ministry of Health office in the capital city. She works full-time for the entire year, and her salary expenditure was $31,400. Her fringe expenditure, so like her health insurance, her vacation time, totaled $5,430. What would we enter for this person? Okay, so we read that she's employed through a prime partner, so we'd say prime. Her gender is female. She's an advisor, so she's a non-service delivery. Her employment title would be other professional staff technical advisor, because that's what she's doing. She does not seem to primarily support DREAMS programming, so we would say no. Her primary program area would be above site because she's working at the national level, and she's working on human resources for health. She does provide technical assistance. She has a salary, so that would be her mode of hire. For government staff or seconded to MOH, we would say yes, seconded to MOH. Her months of work in the past year is 12 because she was working the entire year full time, so her FTE would be 1. She does not seem to primarily support work in the community, and she does not work in or support multiple sites. So her advising is at the national level. So it would apply to theoretically every site in the country, but she's not going to individual sites providing services. So she would not be roving. She's above site. The position is based at the subnational level. I actually think this should be based at the national level. So we should change that because she herself is based in the capital city, but her work is at the national level. So before I share this, I will change that for you. National level. Her primary beneficiary would be a non-targeted population because she's working for a national HRH policy across everyone. She does not seem to have supported public health emergencies this year. And then you can see her salary entered into that total expenditure And that's her total expenditure. So that included her fringe. That's not her take home pay or her personal salary. That's her total expenditure was $31,400. And then within that $31,400, she had an expenditure of $5,430 for fringe. So that's pulled out into the fringe column. So that's one example. Another example, we have a project manager for a sub-recipient partner who's based in Nairobi, and they provide project oversight of technical activities focused on improving coverage of community-based HIV testing among key populations across Nairobi County in Kenya. They're also managing project work plans and milestones. They're male. They worked full-time for the entire year with a salary expenditure, so that includes everything. The salary expenditure includes the fringe of $30,000 and a fringe expenditure of $4,500. So they are sub. We would put in the sub IP name. They are male. They are also non-service delivery because they're not interacting directly with clients. For their employment title, this is a great opportunity to use one of our new employment titles. So they are like managing a program. So I've selected Program Manager Officer. So that's great to have. You also, if they are working potentially on more than one projects or more than one areas, then you might have chosen Provincial District Coordinator. It just really depends on what the scope of their work is. I saw a lot of program management in their work description, so I chose Program Manager Officer. They're not primarily supporting DREAMS programming. For their primary program area, so this is a tricky one. They are working at the above site level. So if they're working at the site level for this, then I would have chosen site HTS or site level testing. Because they're above site, I'm not able to choose that site level program area. So I chose above site, general above site. That's a little bit tricky, and I think we'll try to include some more examples to help clarify that in our Q&A document. They don't provide technical assistance necessarily. They're managing the program, but they're not like technical advising. They are salary. They're not seconded to MOH or government staff. And then we have the same 12 months in the past year, full-time, so 1 FTE. They are not primarily supporting work in the community. Well, they are community-based, so that one actually maybe should be yes. And then they work in or support. They do not work in or support multiple sites. I think because they are managing the program, it would still be no to the community. So they are based at the subnational level because they're based in Nairobi County. So we would report down to that county. So that's the PSNU for Kenya. Their prime beneficiary would be key populations because you see that key populations mentioned in the description. They also did not support other public health emergencies, and you can see the expenditures and the fringe entered in the same way. And then the final one, I'm sorry, I'm going to go through it really quickly because we're running up to the end of our time. So this is a finance manager, but their work is towards managing the award itself. So they're not managing programs, they're not managing a technical area or programmatic area. They're managing the actual award and mechanism, and they're based outside of the OU. So you can see a lot of the same answers, but for their employment title, we would choose IP program management finance staff because they're a finance staff who's working on managing the award itself. Okay, and their primary program area would be IP program management. So hopefully that's helping to clarify a little bit who would count as IP program management staff and who wouldn't. It's can be confusing, and it is a little bit of a change from last year, at least with the primary program area. So we are going to try to provide as many examples as we can, including this one, and hopefully make sure that it's as clear as possible. And then here we do for the sorry, I skipped this. I wanted to point out that for primarily supports DREAMS programming, we do have a yes here because even though they're IP program management, they're primarily managing the part of the award that targets adolescent girls and young women, which is our DREAMS program, presumably. Okay, let's scooch ahead. We only have 8 minutes left. So this is just talking about the location that and how you would choose the location when you're doing these entries for the different scenarios. And then a quick knowledge check. So a facility administrator who supervises staff and manages workflow but does not see clients directly, would this person be reported as service delivery or non-service delivery? I already know you guys know this, but feel free if you want to drop in the chat. Yes, somebody already said it. It's B. Oops, sorry. Non-service delivery, because they're not directly providing service to clients. So we have time for more questions. I don't see any questions in the Q&A box. If anyone has any, please feel free to drop it in and I will pause. But until then, I'm going to move to the next part. Oh, I just saw something. How can a finance manager support dreams? Okay, so the reason I said yes to that is because, so it says that they're working in award management, but it seems that this award is a dreams award. So they're supporting the management and financial plan development for a program that targets adolescent girls and young women. So that's the only reason that we would say yes to dreams. If it was a mechanism that was not dreams, then you would say no. Hopefully that helps. Okay. So let's just very quickly go through the overview of how the actual reporting works in Datum. This is our last section. Okay. So sorry, just seeing one more question about dreams. So this is at the level of the individual. So if your program is dreams, OVC, and HTS, and your biggest piece of your budget is dreams, then you would have to think about each individual staff member, and is their individual time primarily going to dreams? Then yes. If it's primarily going to OVC or HTS, then you would say no. So you might have, one staff will have a yes and another staff will have a no. It will really depend on the staff. And the recording will be available, I think, very quickly, hopefully potentially even today, but we can have Catherine maybe give an update on that at the very end. Okay, so here's the timeline again. Yes, the presentation will be shared. Here's the timeline again. So we went over this in the beginning. So like we saw, the reporting window will open on October 1st, close on November 15th, and then the second one will open on December 2nd for cleaning. Prior to the first, and I really want to encourage you to do this as soon as possible. You want to make sure that you have an active Datum account. There's a difference this year with your Datum account. So even if you had one last year, if you're not logging in frequently to Datum, they will usually close out your Datum account. So you need to refresh it and make sure it's still working. But also, we now have something called Okta Verify. So this is like a two-factor authentication. So it's a little bit complicated. You need to be able to set up your Okta Verify in order to access your Datum account. Everyone needs to do this who needs access to a template or who needs to upload a template. So after you've done that, then you'll log into Datum, you'll download your OU specific template, complete the template, and then you'll again upload to the template afterwards once it's completed. The prime partner will upload to the template. The subrecipients don't need to worry about uploading the data. So this is just going into a little bit more detail about the inventory processor, which is where you upload your template. But the thing that I really want to highlight to you all is that this Okta thing is new. So it's just started in June. And so you really, really want to make sure that you have it set up and you have it working correctly. When I set this up for myself, I had to reach out to their help desk and get like extra help. It's not that confusing, but you want to make sure you have time so you're not in a panic like, oh my gosh, I need the template right now, and I don't have time to set up Okta. I do believe that they're going to be having office hours about Okta, I think October 2nd and 3rd, I believe. I will share out this information when they give it to me about how to attend these office hours if you have questions. But that might be helpful just to make sure. But I would just really encourage you, like, do it now so that you're not last minute worried about setting this up. And even if you're someone who has reported in the past, you are comfortable with Datum, that's awesome. Okta is still probably new to you unless you're like a very, very frequent Datum user. So just want to tag that. Sorry, I'm going to skip ahead of this. I recommend that you visit these slides in the future. They're just about how to like access the template and download it. It's honestly, once you're in Datum, it's not too confusing, and these are step-by-step pictures of slides. But I prefer to not go over 10:30 if we can help it, because I know you all have other things to get to, and it's the end of the day or late for some of you. So I just want to really quickly highlight. So when you are uploading your template, you might receive errors. If you get an error, you're not going to be able to upload your template. And that is based on the data checks that are programmed into the template and into Datum. One thing that I just want to note to you all that is different this year is they've added these little, you can see like little red tiny arrows in the corner of some of the column headers. If you hover over that red arrow or that column header where the question text is, then it will show you a note like this one that I have screenshot here for primary program area. And this will specify for you what is the check. Like what is going to catch me and flag in Datum. And we're hoping that having this spelled out in the template will really help to catch some of those errors before you're trying to upload in Datum. So you can see employment title also has a note, primary program area, direct service delivery, and especially with some of these new dependencies that you're seeing in the template that were added this year, this explains all of those. So hopefully this will help make the upload and the error process a little bit less arduous. But yeah, just wanted to note that those are there intentionally. We didn't forget to remove them. They are there to help you. Okay, and then this is just like recommendations for how to do that final check. Check for those error messages, check for duplicates. You want to make sure you don't accidentally have more than one, the same staff person entered more than once. Check for those really wild outliers where maybe like the wrong currency was used, or maybe an accidental extra zero was added, or an accidental zero was not added, just like anything that looks wildly unusual. I think that your AORs also will do these kinds of checks, and then we'll do them again during the data cleaning window, but really anything you can catch in advance is going to make your life easier and our life easier. So this is just a good guide. So yeah, this is again just some screenshots on downloading, and we have we have two last knowledge checks. I won't make you go through them, but if you see error messages, then you need to you will see it when you try to upload to Datum, which is annoying because it means you might get all the way to thinking you have a completed template, and then when you go to try to upload, or when your Prime partner goes to try to upload, they'll get that error message. So again, that's what we're hoping those notes will help with. But otherwise, you know, we just have to sometimes have a little back and forth to get it to get rid of those error messages and get it uploaded. And the answer is no, Datum will not accept a template if there are any outstanding error messages. So gotta get it working, because we want that data. We do not want to miss any data because you are not able to upload into Datum because of error messages. So this is just this Datum Zendesk will have a lot of this guidance. So it'll have like some information on Okta and how to operate in Datum and how to request a new Datum account. We'll also send that out in the Q&A so that it's at your fingertips. And then here's a guidance for everything. So this is everything we've mentioned: the HRH Inventory Handbook, the intro to the inventory, some job aids, all of that is here. And finally, 1 minute over. So next steps. Like we said, please, as soon as possible, try to set up that Okta account and make sure your Datum is working. Go ahead and try to download the template. If it's not available now, it will be in the next day or two. So go ahead, make sure you can get that template out, look over it, make sure it looks all right for you. Look through this presentation again, and also the recording. Both of these will be available very soon, in the next day or two, the recording and the presentation. They're also, like Catherine mentioned at the beginning, we will have this same presentation again in French and Portuguese in the beginning of October. So those are great resources for you. If you have any questions, please feel free to reach out to this HRH reporting email. We are really happy. Several of us monitor this email account so we can respond quite quickly, and also really appreciate receiving your questions via email because we can add them to the Q&A document that gets shared more widely. If you have questions that are more about your own mechanism, you might have better luck reaching out to your ACORs or your mission HRH POCs. They might have that information a little bit more quickly than we do, or we'll just go and ask them. So cut out the middleman. But really, any question, if you're not sure who to ask, please feel free to email that HRH reporting help desk email address, and we will make sure to get an answer to you. Like I mentioned, we will be circulating a Q&A document. We will include some of the questions that you've asked here, as well as other common questions that we get, and some links to some of these resources. And then finally, you will submit your data, the deadline, November 15th. But again, really recommend that you try to submit it earlier so that you're not last minute scrambling if you're getting errors or if something goes wrong. And I think that is it. If anyone has any remaining questions, please feel free to stay on. Happy to continue to take questions, but otherwise that's the full presentation, and we will share these materials out and share out the Q&A document, and then just look forward to working with you and to another HRH inventory data collection period. And thank you all again for your attention and also for all the hard work that you put in this. Thank you.